Hello everyone, welcome to Small World Aussie channel. My name is Megha. Today I have an interesting topic to discuss, that is tips to have a good clinical placement experience for AIN, nursing and midwifery students. Arrive on time. This shows your discipline. Arrive before the clinical handing over takes place. Consistently late students have a bad reputation on all wards. Your appearance. Your appearance talks for you in the initial days. So make sure that you are wearing your appropriate uniform, work shoes, no nail polish, no fake nails, hair tied up neatly in a bun with your student ID on. Make sure that you keep your phone. You can have your phone on you in your pocket or in your bag. It does not matter as long as it's on silent or on vibration mode. Also, it's very useful to have a small notebook and a pen, and most importantly, a fob watch. Body posture and your expression matters. The registered nurses and the registered midwives on wards, they see students daily. They will understand in a second who is an engaged student. They will only teach students who show their interest. So it's important to take an interest in your learning. Take every learning opportunity. When I was on my clinical placement, I had multiple opportunities to be a part of workshops and seminars. It is then I learned extensively about breastfeeding, how to read CTGs, the mental growth in babies, and much more. And this will enrich your knowledge. Please remember that in a few years' time, you will be the registered nurse or registered midwife or AIN that's going to work on the ward on your own, and you need to take responsibility for that. Do not take photographs of babies, patients, women, any client, nothing. Remember that. Okay, if you're taking a selfie, make sure that there's no patient or any woman walking behind you in the background. Please do not post any photos, any such photos on social media. Be aware of NSW health policies on social media and your hospital's policy. That is also important. Be professional even when you are a student. Do not argue with your colleagues, your senior registered nurse or your registered midwife who's supervising you. Do not argue with them in the corridors or in front of your client or your patients. Do not speak if you speak another mother tongue, please do not speak your language in the corridors. It's fine to speak your language in the staff room, but that's not the same. Be a professional person. Not everybody can understand what you're speaking. And do not share your private information or your personal information with your clients or your patients, such as your phone number, your address. Please maintain the professional boundaries. Once I had a patient who did not want to work with the student. She told me on my face that she did not want me in the room. I accepted that that's her wish, and I informed the registered midwife that this patient does not want to work with the student, and that's okay. It's not you. It's just how it is. Also, do not discuss your patient information on the ward. You might have heard, it's very common, the patient in room number 6 is so and so and so. The patient in room number 5 is demanding, she's a princess, things like that. Please make sure that you do not engage in any of these conversations on the ward. I understand the peer pressure to belong, but this is very unprofessional. You are a student, you're not yet registered. You need to be very professional in your whatever you're doing, whatever you're saying, because your people are supervising you. Your facilitator is going to ask whoever's supervising you about feedback about you, and let's be very professional. Inform your facilitators beforehand if you are sick or if you will be unable to come for the day into the hospital. Be upfront about it, because facilitators will check up on their students unasked. They'll pop up and it's very unprofessional to see that you have not turned up for your shift without letting them know. So it's important to keep them in the loop. Please remember that these facilitators that supervise you will be your reference, will be your future reference when you apply for jobs. So it's very important to have a good relationship with your facilitators. Know your scope as a student. So as an AIN student, you cannot dispense medications on the ward. Does not matter if your supervising your supervising nurse is busy, you just do not do it. Okay. As nursing and midwifery students, we can dispense medications under the direct supervision, which means the registered nurse or the registered midwife has to be there in the room right beside you while you're dispensing medications. Please be really sure. It does not matter if your supervising midwife or nurse is busy. You can get the educator on the ward, you can get the manager on the ward, you can get other midwives or registered nurses on the ward. It's really important. This is a very risky area if you dispense medications on your own, because any day a patient can turn around and tell that you dispense the wrong medications, and you will not be able to do anything for it. There's going to be a very lengthy conversation with your facilitator, and I'm not sure whether there'll be disciplinary action, but just let's not go there. My last point is, even if you are on your clinical placement, please remember to have fun and to learn new skills. Now, because I had AIN experience behind me when I started as a midwifery student, while I was on placement, I was rushing to finish the work because I got it into my mind that, I need to finish the work. I was doing observations, I was doing whatever I can, but in the meantime, I was not practicing or learning new skills like dispensing medications or learning to put an IDC in, things like that. Okay, so this continued till my facilitator had a long chat to me saying that, you're getting too focused on your AIN experience. You need to learn, you need to put good use of your clinical placement as a midwifery student to actually learn and develop those skills that you need to when you become a midwife. So that brings us to the end of another video. Thank you so much for listening to my video. If you enjoy our content, please like, share and subscribe. Please comment below whether you have liked our video, whether you have any suggestions for new videos. I have plans of including a few other midwifery related videos as well. But in the meantime, thank you very much. See you next time in another video.